We're not really in a COVID season or a flu season, but in a respiratory infection season. It's impossible to distinguish based on symptoms what you have from a regular cold to RSV to COVID or flu, especially if you have a mild case. But you can still transmit all of these to others, so we should be looking at this as more of a global, what can I do to prevent respiratory infections, as opposed to what can I do to prevent COVID. And the answers are staying up to date on your vaccines, COVID and the flu, wearing a mask in appropriate settings, or if you're a person who's at exceptional risk, hand washing, and doing everything you can if you do get sick to prevent spreading to others. That includes trying to stay home from work if you can, wearing a mask consistently if you have any kind of symptoms, and being extraordinarily diligent about measures like hand washing. The important thing to know about all of these subvariants is that each of them are still Omicron, so they have the same features that Omicron has. It's highly transmissible. It's not leading to the same degree of hospitalizations or deaths that we saw with previous variants, and your chances of getting severe illness remain much lower if you are vaccinated and up to date with your vaccines than without. And that's really the same that we're seeing across the entire world at this point. Everywhere the Omicron subvariants are becoming more dominant, there is more of what's called immune escape, where those who have previous infection or particularly previous vaccines that were a long time ago are more likely to get infected. But there still seems to be substantial benefit to updating your vaccine now as compared to being previously vaccinated or infected. We've always thought there would be some seasonality to COVID-19, and coming into the holidays especially, we can expect that we're going to see an increase in cases. We'll probably see an increase in hospitalizations as well, owing in part to the natural surge that we're seeing, and owing in part to us seeing low uptake of the bivalent booster vaccines. Hopefully we'll see that increase with the vaccinations and blunt some of that, but this is a respiratory infection season. And it's not just COVID that we have to worry about this time around, but influenza levels are likely to increase as well, and this is expected to be a more severe flu season because we've had 2 years essentially without a flu season. As you enter this season, it's going to be natural to have colds, sniffles, flus, and COVID infections. It's just more likely to occur. If that happens, getting tested is important so that you can avoid exposing others. If you have symptoms, regardless of whether it's COVID or not, masking is still a very good thing to do to prevent others from getting sick.